Hello everybody, I'm Jim Masters with CUTV News. We're on location here in Manhattan, New York to visit with Dr. Susan Kavaler-Adler. She's an extraordinary, respected and renowned psychoanalyst and psychologist who has devoted some 40 years of her life to the field of mental health. In addition to her practice here in Manhattan, she also works with other mental health practitioners to consult with them on their practices as well. In addition, she's a prolific writer of some 6 books that she's penned, as well as countless articles related to the mental health field. She also works with other writers who are dealing with the healing process as well. We're here to visit with her to learn about her incredible approach, her extraordinary successes, and to celebrate her legacy of excellence. Doctor, thank you very much for joining us here on CUTV News. It's such a pleasure and an honor to meet you, and thanks for inviting us to your practice here in Manhattan. We've done radio shows together. We've had some really wonderful, insightful conversations. We're going to do that right now as well and go a little deeper into your experience, 40-plus years of incredible experience in the field of mental health. I want to backtrack a little bit if we can. I want to talk about some of those early inspirations that you've had to want to pursue this extraordinary field of mental health. Tell us about that.
Well, I think there were a number of things. One is that I came from literature, and I was very intrigued with literary characters, and I went to study in Italy when I was 18, and someone in the program that I was in Florence, in Firenze, was talking a lot to me, and she said one day, you know, you listen so well, you really should be a clinical psychologist. And when I went back to Syracuse University for my remaining time, and I was in the honors program, I combined my literature and psychology programs, and I just took to it so quickly that I did great in psychology. And then I went straight into a doctoral program in clinical psychology at Adelphi University at the Gordon Derner Institute. And so that was the academic side of things, getting into it that way. And then the personal came a little later. As I got my PhD, I was a dancer. I got involved in dance therapy at the same time I was doing my doctorate. And so I was in the intellectual and the moving my feelings through improvisational dance to express myself and then see what was coming through from my unconscious. And then I went into my own more traditional psychoanalytic psychotherapy and psychoanalysis, and I started to open up a mourning process for my father, who died when I was 10. And that really inspired me to, on a personal level, to understand the profundity of the grief and mourning process and how psychic change can come about through that. So that fed into my interest in what we call the internal world, and it relates to British and American object relation theory, but it's really about how we carry an internal world within us and how we carry our early parents and our early relationships with us, how they affect us in the present, and how personality change and changing one's lives involves changing that internal world. And the grieving and mourning process is a big part of that, dealing with loss, letting go of the old, opening to the new. So through my own personal experience of mourning, I saw how deeply important all the feeling states were that lead up to grief and mourning, including anger, rage, and ultimately love through the loss and grief, and renewing love through letting go and renewing one's capacity to love and to create. So, because love and creativity open up with the same kind of energy from the mourning process. So it was a combination of the academic interest and being told that I listen really well, and then my interest in dance therapy as a dancer, along with my getting my doctorate in psychology, and then finding how through the mourning process I integrated my intellect, because I could be overly intellectualized since I'd been in school my whole life, integrating that with the sense of my feeling states through movement that I had as a dancer. Through the mourning process, I was able to integrate to really get to the emotional core of things. So it wasn't too much in my head or body, but rather combining it through the emotion. So that showed me a whole way forward, how one moves forward in one's psychic development and therefore in one's life.
So some of the experiences that you've had in academia, along with the opportunities to express your own personal experiences, I think makes you profoundly unique, because you have the opportunity to really relate to your patients, not only, of course, through the academic background, but when they are telling you their problems and frustrations and issues, you can tap into some of the things you've dealt with in your own life and really relate to your patients.
Oh, well, once I got my PhD, which I did when I was just turning 24, and I had done a dissertation that actually, an experimental one that involved dance therapy. But I was a writer, so I was always using both the verbal and nonverbal, which fed into my clinical work. And so I, having been in school my whole life, I worked for 2 years full-time in a hospital where I was a psychologist and outpatient. I did therapy and I did dance therapy. And then I decided, well, time to go back to school for psychoanalytic training. So then I went to the National Institute for the Psychotherapies for psychoanalytic training. And I also, through that, was on their faculty for many years and supervised candidates there after I graduated. Before I even graduated, I was working half-time in a hospital, and I taught the staff there at the state hospital setting with children that I was working at half-time. But while I was working half-time, I started taking private patients. You know, I was licensed right away the year after I got my doctorate, so in 1975, when I was 25, I was licensed to practice. And then I built up my practice to a full practice, so I've really been, if you take it from the very beginning when I started the half-time practice, it's now been, I think, 44 years. So I've had a lot of experience.
So let's now talk about the scope of your practice. Some of the things that you delve into, some of the issues that your patients come to you dealing with, some of those frustrations and anxieties and stresses and fears. Let's talk a little bit more about that.
I have always dealt with the whole person, so whatever somebody comes in with that's bothering them. But I have a special attunement also to issues of mourning, loss, creativity, the development of the creative and relationship capacities in people, and blocks to those capacities in creativity and love, really. And so I work with people both on the couch as psychoanalytic patients, where they're tuned into their unconscious in dreams and fantasies, as well as and that helps them understand what conflicts they're experiencing that might be holding them back in life. And also I work with people sitting up where I sit across from them. It's more of an interpersonal dimension to it. But I always tuning in with using both my nonverbal capacities, like being a dancer, and my very verbal capacities, being a writer also. And so that's the main thing, is using my whole person to tune in and understand people at very different levels, going to the deeper levels of their unconscious motivations and how they defend against their deepest desires and needs, and help them open those up so they can speak, and help the inner child to speak and the emotional needs and desires within them to speak freely, and for them to express a whole range of a human experience, which includes rage and anger and hate, as well as love, loss, grief, and longing. And then I have groups. So I have a monthly Saturday group that I've had for over 29 years, where people, I do a guided visualization. I call it a meditative visualization. People close their eyes and breathe, and then I guide them through seeing who comes up from within, not directed by their head, but allow it to come from within, so it comes from their inner world where they have their real emotional attachments. And someone comes up and they will speak while being silent and breathing deeply. Each person will be speaking to whoever comes up. And we go through this with two people coming up from within, and then they kind of locate themselves where they are in what they're most involved in feeling at the moment through speaking to these internal others. I also help them tune into what their stomach is saying, because the gut reaction is more the hunger, the rage, the hate, the anger, but then tune into their heart and see if they can, while breathing deeply, whether they can connect with the person they're speaking to within through their heart. And through the heart connection, they're moved into more feelings of love and loss and longing and grief. And so the monthly Saturday group, I call it a therapy group, but with the meditative visualization, but I also say it's a mourning and support group. So people dealing with losses of all kinds, not just actual bereavement, but separations and all kinds of losses through their lives. Opening the pain of that and not running from it, as well as regret, which I've written about. I have a book on anatomy of regret. That can be part of mourning too, dealing with the loss one creates by one's own self-sabotage or destructiveness in relationships, and becoming conscious of it rather than denying it or repressing or dissociating from it. Becoming conscious of one's regrets helps one not make the same mistakes over and over and not keep self-sabotaging, but rather learn from it, and just learn from it as a mistake, the regret, and then therefore be able to move forward without repeating that over and over.
Why do we do that? Why do we tend to self-sabotage so much?
Yeah, well, because we have unfulfilled longings and needs, and we get attached sometimes to the same problematic relationships that we had early in life, sometimes traumatic relationships, and sometimes just difficult and conflictual. And we get very attached to these negative things because of the intensity of the anger and aggression we feel, and the sense of wanting to get back at the person, all kinds of reasons we get attached to negativity within ourselves. But it's not just negative thoughts. In my groups and individually, people learn that it's a whole inner world that they're reacting to, that they're attached to particular people they've internalized, or part of people. Like they can be attached on one side of their brain to their love for their mother and a loving mother, and attached on another side to the angry hate for the mother who they felt was depriving in different ways and frustrating. And always mothers and fathers have to be. So, but sometimes it's also, traumatic. Sometimes there's abuse. There's all kinds of levels of what people hold on to from these problematic relationships. So one part of their mind could say, maybe they only want to be conscious of the loving part, and they repress the other part, and then through analysis it opens up and it frees them, because then they don't have to keep holding whole self parts of themselves back that could become creative parts of themselves, and hold themselves back for intimacy because they're afraid of the pain of being in that thing again. They want it, but they're afraid of it, and they want something more, but they tend to get back into the same thing. So the more they become conscious of it, it's all about awareness, and things only change through awareness. People always ask, what should I do? What do I should do now? I say, that's not the question. It's what are you becoming aware of now? Because things only change through awareness. And the awareness of what comes from within is the things we have control to change. People are always trying to change other people and their partners, and a lot of couples therapy. I do couples therapy too. A lot of that has to do with, helping the person not try to change the partner, but try to communicate with the partner and deal with the parts of themselves that they can change and can respond to the other, so the other then can want to change on their own accord. So it's all about awareness and consciousness, and sometimes it's helpful to use somebody lying on the couch to get to those deeper unconscious meanings, and sometimes sitting up, just helping them tune into the most intense feeling states they're having in the moment, help them articulate it. And ultimately, it's all about self-expression rather than being blocked and inhibited about oneself, but not acting it out like a retaliatory impulse towards someone you're angry at, but rather putting it into words. But it's not enough to do that intellectually. So the treatment I do is all about connecting with the feeling towards the other, and then through the feeling and the thoughts then coming from the feeling rather than imposed on the feeling, you can get to understand why they keep going back to the same thing, or what they need to say in order to move past that, or to communicate to the internal other and the external others they're dealing with.
Doctor, I would imagine that forgiveness is a huge part of the equation as well. Forgiving those who maybe did and said things in our lives that weren't so positive and reassuring, but also, very importantly, forgiving ourselves as well, right?
Yes, well, that's, of course, a very important question. The thing is that forgiveness involves a healing process for the self. So sometimes you might not be ready to forgive someone else unless they can acknowledge and apologize for something that they've done. But you still need to, in your internal world, forgive the person in order to release yourself from a constant obsession with that person in your anger, or a constant, wanting to get back at them. This retaliatory impulse that are built into us as human beings and mammals. And so we need to forgive in order to heal ourselves. And then the best situation is when you can forgive someone and actually talk to the person and they can acknowledge what they've done, or you acknowledge to yourself what you've done that you're angry at yourself for and forgive yourself. And that's part of the regret mourning that I was talking about. If you can face your regrets consciously rather than have this defensive stance of I have no regrets, like the famous Pilaf song. If you can face your regrets and own them and realize, we're all making mistakes as human beings. We only grow by making mistakes. Then you can stop repeating the same thing because because you're caught up in some anger and you want to get back at someone, or you keep trying to prove yourself. You can then start to see, if you regret something consciously, you can just be aware of how its consequences, and then through the awareness you can start to change the way you feel and the way you act then, of course.
Another important part of the equation is tapping into and having your patients realize that they might have actually this resilience inside to survive some of the things that they've survived in their lives, and to understand the true value and appreciation for their own self-worth and their contributions, not always listening to what others have said in their lives and what they continue to say, right?
Well, people only come to value themselves authentically and genuinely when they face their fears, and part of the fears they have are not only of other people, judgments, criticism, or all kinds of things they can fear from others, but it's also getting past their own fear of their own aggression. And we all have our internal rage as human beings. In analysis, you can express it in ways you can't socially, or inappropriate express it with one's close to you, then it's destructive to your relationships. So in analysis, with a psychoanalyst like myself, you can express it towards the analyst, or you could express what you feel towards others in your sessions. And then you can find out at a deeper level, what's the vulnerability in you that makes you so enraged? Is this person, why are you stuck on that? Why are you stuck on a particular anger? What is it you want from them that you feel you can never get any other way? What is it or what is it you feel guilty about that makes you keep wanting to accuse them because you feel guilty and you haven't dealt with your guilt? Or what is it you're afraid of within yourself about your own aggression that makes you inhibit it but then act it out in passive-aggressive ways or indirect ways? That's all self-sabotaging. That undermines relationships. And it also blocks having just free thoughts and feelings for our own creative work process. You know, of course, I work with writers because I'm a writer, and I work with all artistic people, but everyone's creative. So I work with opening up creative capacities in everyone. They don't have to be artists or writers. But I particularly tune into, you know, writing blocks and blocks to public speaking. All this relates to fears and conflicts that make us inhibit our voice because we're afraid of our aggression coming out and being destructive. Or we can actually be destructive and then have to really look at why we did that. So they're looking at our deeper fears also has to do with looking at fears of taking others in and fearing what you're taking in from others. Often people, if they're feeling inadequate, they'll project that onto someone else. But then there are people who always own the inadequacy and don't own their strengths. So every person is different, but it's getting at all the parts of the person that they might dissociate or repress. And these are two different ways that people avoid consciousness. And there are all kinds of defenses that an analyst will help the person be aware of so they can stop doing the same thing that inhibits them or is self-destructive or destructive to relationship or to blocking creative work. So it's always a process. You know, people always want the quick fix, but it doesn't work that way in life. And things that they think are good, it's like people go on diets and they have to do it again and again. Any quick fix will have to be done again and again. It wears off very quickly because you really have to change the internal world psychologically for you to be different in your relationships and your work and to move forward if you have conflicts holding you back. And these conflicts can be about, as I said, fears, conflicts between expressing one's anger and fearing it because of fearing the other person's retaliation or retaliation through their judgments or criticism or worse. And it can also be through fear that you're going to hurt the other person. And some people are more working at that level, others working at more with the fear of the other. But there's a lot of projection that goes on from people's minds, expecting how the other's going to act. And that often is a distortion of the other person in reality through the internal world of the person, that they're projecting others from the past, that they're living with internally, that are operating on them right in the moment they project it onto someone who's right with them in the present. Especially intimate partners, they'll project the most from early parents and conflicts with their parents and their needs.
There's a big push these days, I think it's sort of in vogue right now, is living an authentic life. Being true to self, but also being very revealing and very open. Talk about that and the fact that there is this contrast between living this authentic life, but at the same time, we all have masks that we wear. They say that the world is a stage. So we have different masks that we put on for different scenarios, and we're dealing with different people in our lives. So that's a little bit of a contrast that people have to deal with. Let's talk about that and this authenticity that we hear so much about.
Well, first of all, there's a difference between masks and roles. We're in different roles where it's appropriate to be a certain way as a teacher or an analyst. It isn't appropriate in a social situation. It's not appropriate as an analyst to be socializing. You see, every different role requires different things. But, and that doesn't mean that you're being fake. It just means that you're using different parts of you and being offering a different perspective of yourself. And then there's privacy. You know, it doesn't have to be that you're being false or fake, although some people can be if they if they feel so inadequate, they have to present a grand image of themselves. They might have to fake it a lot rather than base things on real achievement, accomplishment, and who they are in the world. But there is a difference between just a normal social privacy where you only relate at a certain level, not the level you relate to the analyst or to an intimate lover. And that doesn't mean it's fake, or it's a mask. It's just that, you're talking on a more what we call social level. It's more superficial, but it doesn't mean you're not genuinely interested in the other person, them knowing you a little bit and you knowing them, but you're also monitoring that, how much you say about yourself, depending on how much you trust that person as you talk to them. So privacy doesn't mean falseness. There are people that feel they have to really, or have developed in childhood, a false, sometimes compliant, or sometimes oppositional self because they were so controlled by their parents in childhood that they have to force themselves to, they had to, as a child, to survive, they had to pretend to be nice when they felt angry, or the oppositional one can't give up the opposition and can't show the loving or tender parts of them because they felt like they had to be tough, otherwise their vulnerability would be taken advantage of and they would be hurt in some way by some comments. So people have different, some people do develop kind of false presentations, but most people it's just a matter of drawing on different parts of their personalities at different times.
Doctor, social media, the internet, advancements in technology can be wonderful things, but they also add in undue pressure for people, right? The pressure to keep up with the Joneses, to really have an opportunity to try to get people to sort of like them and love them, and a lot of that can be really empty, right? It's not the true essence necessarily of human connection. Let's talk about that.
Could be the opposite of connectedness. Yeah, I like the Argentine tango world. I'm an Argentine tango dancer because you're really there with the people dancing and connecting. It's not just through some screen and some
posts and
you're being who you really are, and in the dance you can't fake it.
Exactly.
And also in the office with a therapist, you can't fake it. You have to be your real self, and that's. So I like that I have those two worlds. Where,
do you see an uptick in people struggling with all of this now?
Yes,
these new
people
things?
are very. I have someone who's an artist who's very, very concerned not to get on social media. Very concerned that things that she has ever put on her website get co-opted and used, and then people can distort them and say there's something else. And then I know what I read about, children growing. See, I'm in the somewhat older generation now that wasn't into social media growing up, but the newer generation, it's like kids can really, especially teenagers, can be very concerned with that. They have to present this perfect person, and they don't feel that any of their their needs and their vulnerabilities and their weaknesses can be accepted, and like they feel they're not going to be liked for who they are, and they have to put on a fake image. So I think the social media does go in that direction against authenticity and against real connection, because you can only have real connection through being authentic and expressing what you really feel and think to someone. Yeah.
Doctor, I would imagine as well that oftentimes you come across people who are actually comfortable in their own pain. They're so used to it because it's their normal. It's what they've had all their life. So they have fear of stepping out of the pain because it's fear of the unknown. Are some people actually comfortable in victimhood, in celebrating their own pain?
Well, yes, some people make a narcissistic image of themselves that isn't grand and pretending to be perfect, but that instead they're always exaggerating what a victim they are. and they're using their pain to exploit an image to get people to feel sorry for them or take care of them, or to think they're right, and that that can certainly be part of. Certain people are more wear it on their, it's like a badge for them to be the victim, and they don't want to have to see their own active part in things and their own aggression. But that prevents them from having a sense of agency in things and having their own agency about being responsible for what they say and do, and then changing it if they want. Instead, they get caught up in just wanting to get people to give to them in certain ways, or see them in certain ways, because they say they've been hurt, they've been dealt with badly, they've been injured, and they're a victim, and they could play that out for a lifetime, let alone years. There's real things that people have probably experienced as children that set them up for that, when they really were victims and they were helpless and out of control of the situation. But later on, if they come into therapy, they can develop a sense of agency and realize they have a choice. They don't have to keep being the victim. And they can deal with the pain from childhood, so they're not carrying the pain around and using it to create a victim image. But they have to face the real pain from childhood, but not keep causing people to create pain again so they can claim to be a victim, because they lose their sense of agency and aggression to speak up and express themselves and say what they really need to say about their own needs, with responsibility for their actions.
They say we live in an overprescribed society. A lot of people are taking medicines for this, that, and the other, and we're looking for sort of this wonder drug, this power pill, something that just eases and alleviates our stresses and our pain. Tell us about the importance, not of necessarily medication, really, but of coming to see somebody like you, a psychoanalyst, a psychotherapist, a psychologist. What are the benefits of coming to see you versus depending on medications and other numbing agents and addictive things that sometimes we sort of go towards instead of coming to see somebody like you?
Mm-hmm. Yeah, well, very few of my patients have been on medication or go for medication. Occasionally someone needs it in a crisis, but it is not a solution to anything. Not only does it numb them out, therefore can work against therapy, because people need access to their feelings and all their feelings and thoughts, not to have them numbed out or silenced. But first of all, there are side effects. Everyone knows that, and we're finding out there are worse and worse side effects. Finding out that antidepressants actually make people depressed in the end, and also, depression is a conglomerate of all kinds of things you're blocking from consciousness. So it's, they use the word depression, but there are guilt depressions, there are depressions because people feel empty from internal deprivation from early on, or there's just depression because you haven't dealt with so much that it's blocking you and you're not free to move on. So to take a pill for that, first of all, it doesn't help you build what we call psychic structure, which is through therapy, where you have a relationship with a therapist that gets internalized as a better relationship than the one you may have had earlier on, their primary relationships. That develops the brain. It develops psychic structure. We know now that the brain actually develops through therapeutic relationship being internalized. But also, within the use of the relationship, the sharing together the process of therapy or psychoanalysis or group therapy, as I've told you I do also in couples therapy. By sharing the process, that develops a person's capacity to be aware and develop their sense of agency, self-reflection, observing of themselves, becoming not just always in it in things, but being able to observe and choose and select how they want to be and think about things and how their impact on people, and therefore having more sensitive, better relationships and having better partners. In therapy and psychoanalysis, you get the full attention of the professional who's had years of experience, like I have over 40 years, just focused on you right there. Now, pills are just some chemical thing. And people say, oh, but it's on a chemical level. No, it can be brought to the emotional level. It goes to the chemical level because you're not opening to consciousness and emotions and feelings. If you're willing to face painful feelings, which is why people defend and block things, because they don't want to feel the pain.
And they drink.
They don't want to
other
feel
addictions,
loss,
right.
grief, or how enraged they are, or angry, or be conscious of it, not just act it out. They don't want to feel the painful experiences of loss and need, vulnerability of needing someone who you feel dependent on but you don't control. All those things are things they don't want to feel. But if they develop empathy, they can develop relationships where they do receive from others and in a mutual way, give and take. And it goes past the dominant submission or one person controlling the other. So all these things grow organically, but it can only happen through a relationship with the analyst or psychotherapist. I mean, I'm a psychotherapist and a psychoanalyst psychologist, but basically it's someone who's tuning in to you and what's coming up from in your mind right now. What are you feeling right now? What do you need to say to me right now? Or what do you need to say to someone else that you're coming up from within, or who's in a dream that you're telling me about? So, I mean, taking a pill only stops that process. It gives the false, it creates, well, like it might raise the serotonin level in the brain, but the serotonin level will get raised naturally if they stop, unblock themselves, feel the pain, go through the mourning and go towards more positive feelings through facing the painful feelings with the support of a therapist. It's something that would be intolerable on their own. So I say to people, you know, what's intolerable has been intolerable your whole life can become tolerable because you have the support of me steadily every session in the therapy with the process. So the intolerable becomes tolerable. I have a chapter in the Anatomy of Regret about tolerable and intolerable regret and how I work with it to make it tolerable so people can move past it. And in the morning and spirituality process, I show how spiritual capacities, creative capacities, and erotic passions can be freed and opened up into consciousness so people know, draw on these capacities and have them to be fully alive. And it comes through a developmental mourning process. That's my theories about developmental mourning versus these kind of complexes like the demon lover complex, where someone's attached to a bad object or who's psychologically bad for them, and it's eroticized, it becomes like a demon lover. And sometimes muses turn into demon lovers if you see all the work of the women writers, and it's in their work, it's in their literature. And that's why I wrote the books on them. But those complexes stop a healthy developmental mourning and feeling process. It's not just mourning, it's a feeling process to feel with the therapist what's ever coming up from within at the moment and be free to say it in the session.
I would imagine all of this, of course, is based on the early establishment of trust. Trust between you and the patient and you. Because they're going to be coming here and they're going to be revealing some very deep emotional situations, things that have happened in their lives, their fears, their worries, their anxieties. So at the outset, establishing that trust right away is essential.
Yes, but with the therapist, part of building the trust is for people to be able to say all the distrust and all the fears they have of the therapist, and to become conscious that they're actually afraid of being misunderstood or criticized or judged in a negative way, or retaliated against if they express anger towards the therapist, or if they accuse the therapist, afraid the therapist will retaliate rather than understand where the rage is coming from and why they're angry. So these fears get expressed, and as people take the risk to express the things that they've been afraid to express with others who might actually retaliate and not listen, as opposed to therapists who's there to listen and not retaliate, then as they see the therapist can do that and can survive psychologically with them by hearing them and understanding them rather than just reacting to them, that's how trust is built up. And that's how they get to see also all the roots of their distrust, and how if they're afraid of being criticized or attacked by you verbally right now, that might be because they literally lived with a parent who was always criticizing them and judging them or attacking them in verbal or nonverbal ways. So they get to test out in the relationship. That's why it takes time too. It's a relationship. They have to test the waters. And then if the therapist stays there and stays with them through it, they can see that they can begin to build a different kind of trust. They thought they might be trusting people, but actually they had all this distrust that they weren't aware of from childhood. And then they can see, not just to become a blindly trusting person, but to see that they can open to being more of who they are in a more open way when they develop trust through the analyst, and therefore potential trust for people that they choose in their life that they think are trustworthy for them to be with.
You talked a little bit about object relations and that clinical work. Can you expand on that a little bit more for us, Doctor?
Well, my theory of developmental mourning is an object relations theory because it involves feeling loss and grief for those we carry in the internal world that we still have to separate from. Object relations is about relating to others, persons, as objects within. It's about the self within us, or the internal child within us, and our emotional needs that come from the child place in us often, although the child can grow up in therapy too. But that's where the most vulnerable, needing part of the person is. And we carry within us both the self that we had from childhood in relationship with others that we originally attached to. And as we carry them in their current life, we will be experiencing the other through those. So when I say object relations, I mean the internal others within us and how that influences our relationships externally. And all therapy aims towards helping us have better relationships externally by processing through and understanding the more negative aspects of relationship that we hold on from the past. Like in the extreme case, the demon lover, like holding on to the bad object, and it gets eroticized, it has an intensity. But as we go through the pain and longing and rage and need of the child in us, we don't have a need to hold on to that any longer. And we can really be open to healthier relationships where we can give the better parts of ourselves and take in the good from others. Yeah.
We're living in a world now where everybody is looking for reality. Everything has to be, out on the plate, out in the open. Are we going away from fantasy, from daydreaming? They say that sometimes our society now pushes away fantasy, that it's almost passé, it's old-fashioned, that we don't have time to daydream, we don't have time to fantasize. But a lot of times, some extraordinary creativity comes out of the expressions that we realize through fantasy and daydreaming. Isn't that correct?
Yes. Oh my God. Yes. That's why I do psychoanalytic psychotherapy and psychoanalysis, because it's all about how the meaning in life is all through our inner world, our dreams, our fantasies, our thoughts and feelings that we just can have within ourselves, and then can, through that, can communicate with others what we need and what we want and who we are, and also develop our curiosity about who the other is. But if we don't have that inner aliveness, first of all, we can't have any creative expressions on our artistic development or writing or dancing or any other kind of self-expression, and just speaking to people. Yeah, that would be draining the personality of the juice in it, to be so dried up that you're just focused on, well, this is the facts. I mean, and it's another thing to ignore facts, but you also have to be, as people develop in therapy, they develop their subjectivity. So rather than be just reactive and, you did this to me and I want to get back you, I'm reacting, or I did this because you did that. Instead of that, we can get to appreciating that we have thoughts and feelings, and we have a whole subjectivity, an I-ness, not just being in it, reacting, but being an I with a subjective truth that's evolving every minute as we have new thoughts and feelings. And once we can realize our own subjectivity, we can realize the subjectivity of others and know we could hurt their feelings. Then we could become empathic through realizing they have feelings too. I had a woman I worked with, she's deceased at this time, but I worked with her for many years, who in psychoanalysis, and she was an abstract expressionist painter. But she was very sealed off in her own world interpersonally. She was a great artist, but and one day she just woke up. It didn't happen overnight. It wasn't a quick fix, but as the process of therapy evolved and she became more aware of her inner life and relationship, and more of her subjectivity came into her mind, she was able to realize, oh, other people are having dialogues in their head too. Other people are having feelings
not just
too.
Me.
Right,
not just
right.
Me.
And she was really excited
It's
about
like
it, even
light bulb
ecstatic,
moment.
like this joyous moment,
And
aha
relief
moment.
too, probably.
A relief. I'm not all alone in the world.
Right.
Yeah,
Exactly.
yeah. As empathy grows for the other, and it grows through knowing that they have their own subjective feelings, thoughts, in an inner world, and they're being affected by you, then you can also be more empathic to yourself as your sense of your own subjectivity grows, and you can receive others' empathy more when you are able to trust them, because you know they have a subjectivity as well, like you have your own subjectivity, and they're not just the alien ones or the it that's doing stuff to you and you're reacting, right? So yeah, people become more and more aware of their subjective selves, and they define their lives in new creative ways then. They don't think they have to do the same profession necessarily, but it could be other things. They just want to have different kinds of relationships, or they just find a creative means of self-expression and in a hobby or an art form or vocation that's along with what they do professionally, or they integrate into their professional life. I mean, one thing I like about what I do professionally is I can integrate the writer in me, the dancer in me. I give talks, I teach, and all of it's related to the work I do in the room with the people who are either lying on the couch or sitting up and talking to me, and going into inner states and expressing feelings and thoughts and dreams and fantasies to me.
Another area of real interest for you, I know, is defining the differences between envy and jealousy. Most people probably lump those two together, and they would say envy and jealousy are pretty much the same thing. Now, they may have some strides and threads woven together, but they really are two separate things. Tell us about that.
Yeah, people confuse that all the time. Especially they say they're jealous when they're really envious. And they're really very different, although they have an overlap. So envy is when you, first of all, it comes from a more primitive early level, and there's a lot I mean, jealousy can have a lot of anger in it, but there's a lot more primitive kind of rage in envy. And envy means that you want what somebody else has, and envy is different than admiration. If you admire what someone has, you can say, okay, well, I may not be able to be them, but I can have something like them. I can develop myself and be, and then you don't have to want to destroy what they have. But if you're just envious and you think they have something or they are somebody that I can never have or be, then you feel you want to destroy what they have out of your frustration that you can't have it. And that goes to a very early level in people. And there's an amazing amount of envy being expressed subtly and indirectly in all kinds of ways, sometimes more directly, in more, attacking, assaulting, or putting down people ways. But often it's more by just somebody doesn't get back to you, or somebody gets cold, or somebody doesn't hear what you're saying or really understand you, because their envy is blocking them because they're caught up in just thinking that, you have this thing and they don't have it. So it's a one-to-one thing with envy. And jealousy is a threesome, a triad. I'm jealous that she wants you rather than me, or he wants you rather than me, whatever. But in jealousy, it's a little modified by some love, because even though you might want what this person has, you also feel some love towards the other person that you want to have, that you think they have them. So in jealousy, there's some overlap, because you can envy the person for having this other person, but you also care about this other person. So it's not just hate and destruction because you have what I don't have. I'm jealous that you have this person and I want them, but I want, there's some love related to the other. And it's a threesome in jealousy. The correct use of the word jealousy is when it's a triadic situation.
Doctor, you're also a mentor and clinical supervisor for mental health practitioners. Let's talk about that part of your practice as well.
Yes, well, I supervise people individually if they come to me for private supervision. I also may supervise through the institute that I'm the executive director of, the Object Relations Institute for Psychotherapy and Psychoanalysis, which I founded in 1991. And I also teach classes there, so I've always been teaching since the beginning of my career practically, but now I teach at a more senior level. So I teach other psychotherapists and psychoanalysts in training. I do theory classes and the theory of clinical work, and I do group supervision classes through ORI, the Object Relations Institute. And I teach in my office, and we film it so people all over the world can take the films if they can't be online or in the room at that time. We do both online and in the room. But I also do a monthly private supervision group online that's on a second Friday of the month, New York time, 11:30 to 1. And I do experientially with role plays. So whoever in the group is presenting, we rotate who's presenting a clinical case they're working with. And whoever presents volunteers for a role play. They usually like to volunteer for that. And I play the part of the therapist, and they play the part of the patient. They get inside their patient, and I play the part of the therapist, so they can see right in the moment how I work with that patient, right in the moment, spontaneously. So people learn from that. So I do this monthly online supervision group. I also have a monthly writing group in person, and I have this monthly morning in therapy and meditative visualization group that I talked about before, where we do that deep meditative visualization that people share the visualization and others respond to them from what comes up from their inner world.
Doctor, we talked a little bit about regret and the importance of dealing with regret. Actually, you wrote a whole book about it called The Anatomy of Regret. Talk about the inspiration for this book. What was it about this particular topic that spoke to you enough to want to write a book about it?
It had to do with some of my own personal regret that I was facing and finding how important it was to understand it in order not to repeat certain things that were self-destructive to myself or in my relationships, and but also with my patients, seeing their regrets and seeing how important it was for them to own their regrets rather than denying them, to get past self-sabotaging patterns and to improve particularly their intimate relationships, and not to keep repeating the same things. But there are stories in here. They're really, my books, my students and others who read my books have said they read like novels. So more like literary experiences of stories than just psychoanalytic theory.
Another book that you wrote is the Klein Winnicott Dialectic. Tell us about the importance of this book. What is this book about?
Well, there are two very fascinating figures in the history of psychoanalytic clinical work and theory. One is Melanie Klein and one is D.W. Winnicott. People outside the field of psychoanalysis and psychotherapy often have heard of Winnicott more than of Melanie Klein, but both of them are profound theorists in terms of all the things I've been talking about today. So this book is about each of them and how their mothers influence their theories and how their mothers in a way are part of their theoretical thinking, and then how you can integrate Winnicott's thinking and Klein's. And when you do so, you start to get towards my theory of developmental mourning. So I show how clinical chapters, how when you integrate their Winnicott and Klein and my own thinking of developmental mourning, you get the most potent kind of clinical work that you can do, in my belief, yeah.
Doctor, we've talked a lot about mourning and loss. You actually wrote a book called Mourning, Spirituality, and Psychic Change. Let's talk a little about this book and some of the things that people can benefit from reading a book like this.
Yes, well, here again you have clinical stories. Now for those in the field, they might also be interested in the beginning parts where I talk about theories of main British theorists like Winnicott, Fairbairn, Freud, Klein, and Bowlby and Michael Balint. But the larger part of the book is about clinical stories where you get verbatim the voice of the patient and how I interpret things to them, how they then can interpret things and have insights, and the grief and loss aspect of the journey they're on is highlighted in these cases. You see, though, in the session how they're talking and how I'm talking to them and how they change and grow. You see like a whole evolution, like I said, towards spiritual parts coming out, creative parts coming out, maybe a feminine side being further developed in a woman, and I had a bisexual woman where the feminine development was very important to make her a whole person, and also heterosexual woman finding her homoerotic side and her femininity and her spirituality and creativity. And then I have also the development, you see, of the passionate part of the person, so it comes out in erotic fantasies, thoughts, dreams that emerge in relation to the analyst or in relation to people in their lives, and how they describe it and understand that they can have a more fuller expression of those parts of themselves than they were allowed by the inner parent figures within them. Yeah.
We also touched upon demon lovers. Maybe we can go into that a little bit more. And you have this book, The Compulsion to Create Women Writers and Their Demon Lovers. What is this book about? It sounds fascinating.
Yes. Well, I have 2 books on women artists and writers. This is particularly on writers, and I wrote it out of my own sense that the creative process was a salvation for me in my life when I went through hard times. But I also realized that being able to mourn through the creative process is so important, and some people cannot do that and do healing through the creative process unless they've had therapy to be able to have the capacities to mourn. And then they can use their creativity more. And otherwise, they keep repeating the same traumas over and over in their work, like certain women did here. Now, I have the contrast between Charlotte Bronte, who didn't have the kind of early trauma that Emily Bronte, Emily Dickinson, Edith Sitwell did and Sylvia Plath. I also write about Anais Nin here. But because Charlotte Bronte was able to mourn very vividly in her creative work and move on to be able to have a marriage through that. And she wrote in her last volume, her last novel, Villette, which is less known than Jane Eyre. That was where the characters really emerged, where the writing was character-driven rather than plot-driven, and where the characters emerged into transforming each other and in the end having a mutual relationship, and the chauvinism and the man being dissolved more into a loving mutuality, and the woman being able to own her own strength and self-expression and therefore participate in a more mature mutual relationship with a man. And you can see that in Charlotte Bronte's writing of Villette, where the narrator was actually mirroring Charlotte Bronte's own mourning for the losses in her family and going back to the loss of her mother in childhood. Her younger sister, Emily, couldn't mourn through her work because she lost the mother when she was 2 years old rather than 5 when Charlotte had the loss. And she got stuck in a place where she didn't yet internalize enough of a good aspect of the mother. So she didn't have the capacity yet to mourn in her work, and she kept repeating trauma over and over. Whereas Charlotte moved through this into these character development in her work and into being able to actually mourn and heal through her writing, because she had internalized more of the good mother. If Emily Bronte had been with a therapist who could help her internalize something better of the good relationship with the therapist, then she could have modified the early traumatic reaction to loss and could have being open more to sustaining loving and creative capacities and without repetition of trauma all the time in her work.
I love the cover of this book, Doctor, The Creative Mystique, From Red Shoes Frenzy to Love and Creativity. Tell us about this book. What is this book all about?
Yes. This one, I think, is the most popular for people not only in my field, but outside of the field, in the general public. Here are incredibly vivid and dramatic tales of women writers and artists who, as in the Compulsion to Create, tell their stories. But this whole book is about the stories. The other also has theory, so it's good for people in my field. In this book, you just have one story after the other, and people learn about psychological development by reading the stories of women, and not only women, but brilliant and well-known artists. And you have some of the tragic tales, but you also have, again, like Charlotte Bronte, in contrast to the others who got stuck in a certain place, even though they were brilliant in their creativity. Here you have Suzanne Farrell, the New York City Ballet, who dealt so wonderfully with having a whole drama with Balanchine that where she was blacklisted in America because she wouldn't marry him. She because she had internalized enough of the good mother, was able to not demonize the man and was able to still create out of his work, go to Europe, work there, and come back and work with his music and with his art again, and have a reconciliation, because she never demonized him and got attached to a bad object, because she had enough of the good mother internalized from the beginning. Whereas the other artists I write about often had tragic endings, even though they put out such brilliant, wonderful work for us. So we have Camille Claudel with Auguste Rodin, the sculptor. Now he's much more known, but she was brilliant, creative sculptress in her own right. She smashed her own work ritualistically towards the end of, well, towards the middle of her life, and then she was put into an insane asylum for the rest of her life. Tragic, tragic end with a brilliant woman artist. And Rodin recognized that she was a master artist. But in those days, he was signing a lot of her work, so we think it's his work that's really her work. And she then sabotaged herself by smashing her work. So what I'm saying is, when there's early trauma and a lack of a loving relationship internalized, the woman herself becomes self-destructive. And you see so many stories of that, but you also see how their creative development is there as well, and how it was their salvation. And we have Virginia Woolf in here, Anne Sexton, Catherine Mansfield, and I also have some clinical cases at the end, and yeah, and Camille Claudel, Diane Arbus, the photographer. And even though they had tragedy and suicide in many cases, they had brilliant creative processes that are in this work too. Yeah.
Now, another area that you wanted to touch upon, I know, is fear of success. During the radio broadcast, you and I talked about a friend of mine who we had great conversations till 5 o'clock in the morning about this fear of success that he had. Not the fear of reaching the top and then going down once you reach the top, but fear of reaching the pinnacle, and the pinnacle not at all resembling what those expectations that he set up were, and getting depressed over that and anxious over the fact that you reached this top, this pinnacle of success, and it's not matching, and there's emptiness, there's nothing left. Let's talk about that, this fear of success that many people have.
Right. Well, that, yes, you brought in the situation of your friend, but that was his conscious fear, was that he would get there and it wouldn't be what he expected. But that's only the conscious level. The deeper unconscious fears are usually of that the person would actually, you know, just be empty and destroyed by the fact that they thought everything inside would feel better and they'd resolve their traumas just by being successful. It doesn't happen. So then they get there, and that's often when famous actors, artists, suicide, because they get there and it doesn't solve anything from the inside of them. But the fears of success that people carry mostly are fear of that they're going to be, some people have guilt and that holds them back. Fear that if they go past their parents, and particularly the same-sex parent as them, who they might be competing with from in childhood, as all children do with the same, they compete with both parents, but they can compete more with the one that's they're more identified with. So they might fear if their father didn't go further in life, or in the case of somebody I work with who's really successful now and is speaking all over the world in relation to his work, and has developed a whole center for his ideas and his work. He's had to deal with a lot of things holding him back in speaking out about his work, because his father had a tragic ending. His father became an alcoholic and was destructive to himself. So my patient had the guilt about going past him and having a good life when his father didn't. It happened in a woman writer that I work with. She came to me to resolve all her blocks, but part of the blocks to going ahead with the kind of writing she wanted to do, which was of a fictional nature, which she has done now, and really done with a depth of feelings that she never had before through her analysis, because she was one of the people on the couch several days a week. She always had, similar to the guy feeling towards the mother, guilt about towards his father. She had guilt towards the mother, that the mother died of cancer and didn't fulfill herself as an artist, so she felt she would maybe not, now that she's enjoying her life and doing what she really wanted, because this art and writing was her second, it's her avocation. She had another profession, but this is what she really always wanted to do. Now that she's having it, there's the guilt that she would have a better life than her mother. That's one thing that holds people back, is they don't want to sabotage the parent in their mind.
So as you can see, through her compassion, her understanding of the human condition, and her incredible experience of some 40+ years, Dr. Susan Kavaler-Adler is an extraordinary individual, making our world a better place and helping people heal one person at a time. If you'd like to learn more, visit her website, Kavaler-Adler.com. In Manhattan, New York, I'm Jim Masters, CU TV News.